في البداية طبعا بشكر دكتورة منى سالم ودكتورة منى ممدوح for this great workshop. أنا عارفة إن أنا آخر سبيكر وآي ثينك إن إحنا كلنا هايبوجلايسيميك، وأنا كمان هتكلم على الإكسرسايز فهيجي لنا هايبوجلايسيميا أكتر إن شاء الله. احنا النهارده هنتكلم على challenging of managing exercise in children with type 1 diabetes، وفي الحقيقة هي one of the most challenging issues في المانجمنت عموما. كلنا عارفين ان guidelines بتقول ان ال activity recommendations for any children and adolescents with type 1 diabetes are the same as the same population. ليه؟ لأن diabetes does not and should not limit the ability to excel in any chosen sports. كل children and adolescents from 6 to 18 years old has to do an exercise of 60 minutes or more each day, including moderate to vigorous aerobic activity and also muscle and bone strengthening exercises. لكن children with type 1 diabetes are less fit than non-diabetic, particularly if they have poor glycemic control. وده ليه؟ Because of the altered muscle ultrastructure and mitochondrial dysfunction, impairment of the muscle capacity and also alteration in the inflammatory oxidative metabolic responses. احنا عندنا two main types of exercises. continuous moderate to vigorous intensity اللي هي jogging بالعربي اللي هي أنا صراحة ماليش في العربي دورت عليها اللي هي الهرولة اللي هي المشي السريع شوية، الرننج swimming and bicycling. ده مختلف تماما عن الميكسد aerobic and anaerobic exercising اللي هي hopping, dancing, gymnastic and team sports. كلنا عارفين ال benefits of exercise from not just بس glycemic control لكن weight control, improved sense of well-being, decrease cardiovascular risk وكمان improvement of the microvascular reactivity. ودي brochures بتتحط دايما في الجيم ان هي للولاد الادolescents، بيقول ان انت لما تعمل exercise you will control not just your blood pressure but also your weight and you will improve your emotion and your mood and you will lower down the risk of heart disease, you will lower the blood pressure and also you will lower your stress. There are many factors affecting a blood glucose response to exercise, including the duration of the exercise, intensity, and also the type of exercise, as we said later. And here we are in the dilemma, either aerobic exercises which cause hypoglycemia and anaerobic exercises which cause hyperglycemia. And here is the dilemma. This is a famous diagram of the Elsayed guidelines talking about the different types of exercise, and each one of them causes changes of the blood glucose either hypo or hyper. Don't forget that the hypoglycemia during exercise not just occurred just during, but it may be also immediately after or delayed after exercise by more than hours. Causes of the late hypoglycemia, it's caused because of the late effect of the increased insulin sensitivity and the delay in the replenishing liver and muscle glycogen stores, and also because of the attenuated glucose counter-regulatory hormones that occurs especially during night. And here first question, الأم دايما بتسألنا هعمل إيه في الإنسولين؟ The insulin adjustment during exercise, and I will try to make it as simple as I can. First of all, talking about the bolus insulin, we have a meal before exercise and meal after exercise. الميل after exercise ديت سهلة، هنعمل up to 50% reduction of the bolus dose. What about the meal before exercise? It will depend according the duration of exercise. So if the exercise is vigorous or aerobic activity, according to its duration, if it is last between 30 to 45 minutes, so we have to make a reduction from 25 to 50% of the bolus dose. But if it is longer, more than 45 minutes, we will do more reduction, about 50 to 75% of the usual bolus dose. What about the anaerobic exercise? Again, if from 30 to 45, it will much less because, as we said in later, it causes somehow hyperglycemia. So we'll make a smaller reduction, about 25% only. But if it lasts more than 45 minutes, we will do about 50% reduction. Talking about the basal insulin, we have to do a 30 to 50% reduction of the long-acting basal insulin the night before and on the day of the activity. And if we are using the pump therapy, we will do the same reduction throughout the day and also maybe the night following this exercise. The second question the mother always asks, what I am going to give my child during exercise? هديله ايه during the exercise? So talking about the carb intake, we have 5 steps. First of all, 3 to 4 hours before the exercise, the baby has to be given a low-fat, whole grain, low glycemic index as a part of his mixed meal. And immediately before the exercise, we can give him just a snack of 10 to 15 gram carbohydrate if indicated by the blood glucose and the activity adhere. If the blood glucose level is less than 90, so we should give a 10 to 20 gram of carbohydrate before any type of exercise. And if the blood glucose from 90 to 124, we have to give the same amount of carbohydrate, but just before the aerobic exercise, not the anaerobic. And if the blood glucose from 126 to 180, so no carb is needed before the start, but take care, it may be needed soon afterward. And the blood glucose, if it is high, 182 to 252, we can start it immediately without giving an additional carb intake. But take care, if your blood glucose is more than 252, so you have to recheck the blood ketones and don't do your exercise. What about during exercise? We will have to give a 10 to 15 gram of carbohydrate per 30 minutes of aerobic or longer duration activity. And it is not usually needed for anaerobic or short duration exercise unless indicated by the blood glucose level. What about the step 4, which is immediately post-exercise? If the meal has to be given within 1 hour of your finishing of your exercise, so we will not need to give any more carb unless indicated by the blood glucose. But if your meal will be delayed more than 1 hour after the exercise, so you have to take a snack of 10-15 gram of carbohydrates. And finally, 1 to 2 hours after the exercise, you have to take also a low-fat, whole grain, low glycemic index as a part of the mixed meal. And in the exercise, which is done immediately before sleep, you have to give an additional bedtime snack. And here is an example of some of the snacks that can be given, like a medium-sized banana or apple juice, or maybe a granola bar. What about the hyperglycemia, the other side, which is commonly the mother came complaining, my baby is practiced well and causing hypoglycemia during exercise, لكن لما يجي يدخل بقى في المسابقة وعنده بطولة جمهورية، لا ده سكره بيطلع في السماء. So this is the hyperglycemia that may occur in the high intensity exercise due to the release of catecholamines or after excessive of carbohydrate intake, or you have to do too large insulin reduction. And during competition, of course, hyperglycemia occurs due to stress release of catecholamines. And here, what we are going to do, we have to do an additional dose of the rapid-acting insulin, about 50% of his usual correction dose if the random blood glucose is more than 252. And this is a famous diagram also from the SPAD talking about the blood glucose level and the blood ketones level and what to do, either not to avoid exercise or your check, or you will give a correction dose. All of this to avoid the glucose excursion, as we said, during all these days, because it affects the complication, especially the microvascular and cardiovascular complication. And to finalize, the SPAD did a 12-step recommendation for avoiding hypoglycemia during exercise in children with type 1 diabetes. Very important and very short. Number 1, you have to arrive in the target metabolic control before exercise. And don't forget, you always bring your carb with you. And of course, you have to increase the intensity and duration of exercise progressively. يعني الولد مش أول لما ينزل وراح واخد التراك مرة واحدة. It's slowly. Number 4, and before doing exercise, you have to ingest a slowly absorbing carb. Don't forget, you have to decrease the insulin dose during and after intense muscular activity, and very, very important, do not inject insulin at the site that will be heavily involved in the muscular activity. For example, لو الولد نازل يعمل فوتبول يبقى احنا we will not inject in the legs or in the sides عشان دي الليمب اللي هيتحرك كتير. Again, decrease the insulin dose when the physical activity is planned at the peak of the insulin action, and if the activity will be prolonged, don't forget to take your carb before, during, and after. Of course, you have to measure your blood pressure before, during, and after, and take care of the risk of nocturnal hypoglycemia. And again, you have to evaluate the effect of each modification, either in the insulin dose or in the carb counting or the carb intake. And take care, you have to make sure that the people around you, for example, in the club or in the trainer, that beware of your condition and also beware to how to treat a severe hypoglycemia. And of course, which is somewhat better, of course, if you are going to do CGM, you have to check for the arrows and the alert levels for the decreasing levels of blood glucose. So this is the 12 steps of SPAD for how to avoid hypoglycemia. الناس منكم يعرفوني شوية أنا بحب الابريفيشن. فأنا قلت لا مش هجود على الإثبات بس أنا قلت إن أنا I will add 2 more steps 2E. So I will add education and encouragement. We have to educate the family, educate the mother, education at school, education at the club for all these manifestations. And please encourage them for sports, encourage them for doing the exercise. And again, when we add them 12 plus 2, it will equal to 14, which is the World Diabetes Day that we are celebrating in our workshop today. And finally, this is the SPAD guidelines of the exercise. You can all download for free. It's full of many tables and many other informations. And I recommend that all of you read it and practice it with your patients. Finally, the management of diabetes is not just a science, it's an art. It needs an artist to fine-tune all your patients because it's not all the children are the same. Everyone is different from the other one. And you have to tailor your treatment for each patient and you have to individualize your treatment to be a good doctor. And finally, I am the last speaker, but I hope I will not be the least, and I hope that you will not be just like this after our talk and after my talk especially. And finally, thank you.